everyone, and happy Friday. My name is Kayla, and today I'm going to be giving everyone a brief introduction on different types of breathing techniques that you can utilize for stress management. At the end, we'll go ahead and do some breathing practice with some gentle movement. So why is this so important? We know that stress wreaks havoc on the body. We know that stress contributes to poor health behaviors that are linked to increased cardiovascular disease. But acutely, we know that stress can cause changes in mood, including increase in irritability and anxiety. It can increase your heart rate and your blood pressure, causes an increase in inflammation throughout the body. It can influence digestion, causing cramps, poor nutrition absorption, and abnormal bowel movements. It can also make our muscles really tense and less likely to respond to stimuli. But today we're really focused on the breathing. Stress causes your diaphragm to push upward, which causes your breathing to become more shallow and making you breathe more quickly. So we can see that there's a strong relationship between stress and breathing where they're intimately connected. We can, however, change one by influencing the other. So if we focus on our breathing and slow our breathing down, we can hopefully produce an improved stress response as well. It is evident through research and ancient wisdom that controlling our breathing is a powerful tool for quieting our minds and entering a state of calm. Therefore, we're focusing on different types of breathing techniques to help with our stress response or fight or flight response. So we'll focus on 6 breathing techniques within this presentation today. We'll review deep breathing, breath focus, pursed lips breathing, alternate nostril breathing, box breathing, and diaphragmatic breathing. All can be very beneficial and performed in a really short period of time. So deep breathing is exactly as it sounds. We want to be sitting or lying on our backs with our elbows against our sides, and you're simply inhaling, exhaling, and repeating. It sounds simple, but as you're breathing, the idea is to focus on the sensation of your breath coming in and out of your body. You want to be feeling your breath moving into your belly rather than in your chest. Then exhaling fully to slowly empty the lungs completely. There's a brief breath hold after your inhale and prior to your exhale, but the idea is that you take in a full deep breath as much as possible, take a pause, and then exhale completely prior to repeating. Breath focus uses focus words or phrases, and we're matching those words with each phase of the breath cycle. So you can be breathing in calm, breathing out nervousness, breathing in peace and exhaling stress. You can be breathing in calm and exhaling worry, breathing in calm and exhaling stress. So you're picking your own individual focus words to again pair with each inhale and exhale. So for example, you might imagine that the air you inhale brings in waves of peace and calm throughout your body, while mentally stating, inhaling peace and calm. And then you might imagine that the air that you exhale is washing away tension and anxiety. You would state in your mind that you are exhaling tension and anxiety. Pursed lips breathing is a little bit different. Here, you're taking in a breath through your nose and then exhaling slowly through pursed, puckered lips, much like you would if you were blowing out a candle or blowing on a spoonful of hot soup. The idea is that you take the breath into your nose for the count of 2, and then blow it out through pursed lips on the count of 4, where the exhale is twice as long as the inhale. Breathing in, blowing it out. Then we have alternate nostril breathing, which seems very strange and can be really challenging if you have a stuffy nose. However, you're taking your thumb and your ring finger to create a V. As you inhale, you're going to block one nostril, and then as you exhale, you're going to block the opposite nostril and let air out of the other side of your nose. And you would keep alternating, where you breathe in through one side and then breathe out through the opposite side. You can even change hands. Really doesn't matter if you're using your dominant hand or not here, just simply a different breathing technique here that might be useful to you. Box breathing can be a little bit more challenging, but the idea is to follow in the shape of a box with each component of your breath cycle. However, there is a breath hold before and after the exhale. So inhaling on the count of 4, holding for the count of 4, exhaling for the count of 4, and then holding for the count of 4 again before you take the inhale. So again, a much more challenging breathing technique that requires a bit of practice and focus. This one is a little bit anxiety provoking for our patients who feel short of breath in general, but there are some benefits. We know that box breathing with practice and mastery can bring balance to your body and your mind. It can help to regulate your natural rhythm and effectively deal with stress, anxiety, and anger. So again, very beneficial, worth practicing. However, this is probably the most challenging breathing technique that's going to take a little bit of time for you to master. Lastly, diaphragmatic breathing. This one takes a lot of practice as well. When you're first learning diaphragmatic breathing, I would encourage you to do so when lying down in bed, but it can also be done seated as well. Really helpful to have one hand over your heart and the opposite hand on your belly, because ultimately you're breathing into your belly. Using your hands is really helpful here to actually feel your chest and belly rising with each inhalation, and then falling back to neutral on each exhalation. So you'd be inhaling, moving the breath down into your lungs, and then filling your belly completely. You would feel your belly puff out into your hand, and then you would slowly release the breath out through your lungs, pulling your belly back into where it started, and then repeat. Before we get into our brief practice, connecting some of these breathing practices with gentle movement, I encourage you to keep an open mind when you're attending these stress management sessions. Our goal is to introduce you to a lot of different techniques, hoping that you'll find one that speaks to you that you wouldn't mind practicing at home. So before we get into today's practice, I'd like for everyone to please silence their phones and do the very best you can in following along. First, I'll invite everyone to find a comfortable seated position in your chair. Simply rest your hands on your thighs. Feel your sit bones rest heavy in the seat beneath you. Relax your shoulders down away from your ears. If you feel comfortable to do so, close your eyes. Otherwise, gently gaze down towards the floor. Begin with some deep breathing. Inhaling deeply to fill your lungs and belly completely with air. Pause, and then slowly exhale until you've completely released the lungs of air. Continue to repeat at your own pace, inhaling deeply, pause, and exhale completely. take 2 more breath cycles at your own pace. In and out. In and out. Next, inhale with your eyes open or closed. Bring one ear over towards your shoulder on one side, stretching out your neck. Here with normal breath. Taking an inhalation and then exhaling the opposite ear over to your other side. Pause and hold here with normal breathing. To center, exhaling your hands outside your hips. This time you're going to inhale the hands up to shoulder height and then exhale them down to your thighs. Inhale to stretch the hands outward in front of you and then exhale to release. Inhale, extending the arms, energy extends out through the fingertips. Exhale, release. 2 more times. Inhale, extending the arms forward. Exhale to release. Last one, inhale. And exhale to release. Next, you're going to give yourself a big hug, trying to rest your fingers on the outsides of the shoulders. As you inhale, looking down towards the elbows, chin to chest. And then exhale to lift your gaze. Inhaling the chin to chest. Exhaling to lift your gaze. This time, do the very best you can, inhaling to lift your elbows up towards the sky, and then exhaling to bring them right back down. Inhale, elbows rise up. Exhale, release. Inhale, elbows up. Exhale, release. Last time, inhale the elbows up. And exhale, release. Bring the hands back down towards the thighs. We're going to be doing some shoulder shrugs next. First, let's take an inhale to bring the shoulders up towards the ears. And then exhale, allowing them to relax completely. Inhale, shrug the shoulders. Exhale, release. Inhale, shrug the shoulders. Exhale, release. One last time. Inhale, shoulders to ears. And then exhale them right back down. Let's draw our attention inward, back towards our breathing. This time, as you inhale, think of peace and calm. As you exhale, think of releasing worry and anxiety. Inhale, calm. Exhale, stress. Inhale, peace. Exhale, worry. Inhale, positive energy. Exhale, negative thoughts. Inhale, peace. Exhale, anxiety. Next, we're going to breathe in through the nose for 2, and then exhaling it out through pursed lips for 4. In through the nose. Exhale through pursed lips. Two more times. Inhale through the nose. Exhale through pursed lips. Last time, in through the nose on the 2, 1. Exhale through the lips. 3, 2, and 1. Returning to our comfortable seated position, except now we're going to move forward slightly towards the front edge of the chair. Taking your hands behind you, if you can rest them on your seat, that's great. If not, you can simply just reach them backwards towards the wall behind you. Simply inhale, lift your gaze towards the sky, and open up through the front body, allowing your chin to lift slightly, bring your chest up towards the sky, feeling that stretch through the front of your shoulders. Pausing here to feel this stretch. Turn gently into your seat back with your spine supported yet again. Except this time, place your hands on your thighs and then round your back, much like you would see a cat do when they stretch. Chin moves towards your chest. You're trying to round your spine here, creating length between each of your vertebrae, and hold. Gently return to a neutral spine. Simply roll the wrists in one direction. And then change direction, moving the wrists in the opposite direction. Again, returning them gently into your thighs. Next, we're going to go ahead and take our hand into our V. You can use your thumb and little finger, thumb, or ring finger, and we're going to take that thumb to one side of the nose. As you inhale, transition that index finger to the opposite side and exhale through your other nostril. Alternating thumb to one side, inhale, and then exhale to block the other side, breathing out through the other nose. Inhale, block one side. Exhale, close the other. More time, inhale, block one side of the nose. And then exhale, block the opposite side. Release, and then lastly, we're going to bring our hand to our heart center. The opposite hand to our belly. Try some diaphragmatic breathing here. As you take a deep inhale, feel your chest and belly rise. And then feel them return back to baseline as you exhale. Breathing deeply, filling the lungs with air and pushing your belly button outward. Exhaling to feel them release back to baseline. Inhale, breathe deeply. Feel the chest and belly move outward and towards your palms. And exhale, feeling them release. One last time. Deeply inhale, feeling your chest. And then your belly fill with air completely. And gently exhale, feeling them recoil back to baseline. Releasing your hands. I'd like for everyone to either gaze down towards the floor or shut your eyes if you're comfortable doing so. Drawing your attention into the sensations of how you are feeling in this moment. Today's movement and breathing practice. Release tension from your muscles. Did it slow your breathing and your heart rate? Do you notice that you feel a little bit less stressed and anxious? Or do you feel quite the opposite? Do you feel that that produced more tension and anxiety? Whatever it may be, simply notice. As you keep the eyes closed or simply gaze down towards the earth, return to a normal breath cycle as I share the quote of the day. Relaxation means releasing all concern and tension and letting the natural order of life flow through one's being. As you feel comfortable to do so, lift your gaze and open your eyes. Thank you all so much for practicing with me today. I hope that you found this helpful and that you allow breathing to help in moments of stress. Be well. Bye now.